be in deep and in-deep information about the exercises and therapeutic treatments. We are having a session in outside, workshop, hands-on workshop is going on. You can meet there. They will explain all the exercises very deeply. So let us start our session. So we are discussing today about the musculoskeletal injuries and how to prevent through physiotherapy exercises in advance and in guidelines of the physiotherapy treatment. So what to do? We all explore what to do before and after exercises, before exercises and during the exercises. So the biomechanical changes, it happens in the body, we need to understand first. To address most common injuries in the sports, first you need to understand the biomechanical changes of the body. So nowadays everybody's wish is, they love sports but they would not prefer not have the sport injuries, because last year it was recently reported that 43% of the sports athletes are not participating in the athletes due to the sport injuries. So firstly we need to understand why do sport injuries are common in sports persons. To simplification this theory, I would like to give an example. So our posture, unlike mammals and animals, our posture should be erect to the gravity. No, it should be erect to the gravity. But fortunately, in sports, you people are often changing this principle by deviating from this principle by jumping, running, and such kind of actions like swimming. These movements are deviating from this principle to increase our musculoskeletal injuries. The common musculoskeletal injuries are like shoulder capsulitis, tennis elbow, golfer's elbow, so ACL injuries and PCL injuries and spondylosis and nosebleeds, bursitis. So many injuries are there. We already often need to occur in our sports injuries. The major risk factors in these sports injuries are, there are three risk factors are there. The first is the internal risk factors, and second one is the external risk factors, and third one is the incident event. So the first one is the age. Age is the primary motto and sex anatomy, anatomical positions and body compositions. Health and injury history is the most risk factor of the internal risk factors. And secondary, external risk factors. External means it comes from the outside, like environment, sports, and rules of the coaches and protective equipment. The same way, initiating event, player, opponent, and gross biomechanical descriptions will all impact on your injuries. So overall, in all these injuries, all these risk factors, there are 4 biomechanical factors are involved in this. First is the poor posture and biomechanics, and second one is the insufficient warm-up and cool-down, and third one is the inadequate training, and fourth one is the imbalance and weakness. So before we going to treat the common musculoskeletal injuries, we need to maintain some strategies, that is called injury preventive strategies. First, we'll discuss one by one. Wearing a shoes like appropriate shoes, it protect your feet injuries. As well, doing a second one is the dynamic warm-up. Dynamic warm-up means it prepares your body actively and increasing your blood flow and joint mobility. These are the examples of the lunges and warm-up of your shoulder circles, as well lateral shuffles. The same way, after every activity, after every injuries, after every activity and every sport, we need to follow the stretches. It holds your muscles, and improve your flexibility and decrease your muscle spasm. Increasing training. The fourth point is increasing training. It guidelines of the 10% rule. The 10% rule is increase your increasing your volume of the training 10% per week. So don't give attached stretch more than 10% of the increasing value. And fifth one is reducing your activities. Whichever the actions hurts your problem, you should avoid that problem. And final is maintain a healthy weight and follow a healthy diet. So in all, we need to follow the four important things. The first one is improving of flexibility and range of motion, and second one is strengthening and enhancing proprioception, and fourth one is developing personalized exercise and enhancing posture and biomechanics. So before handling the soft tissue injuries, we need to follow the peace love protocol. The peace love protocol is nothing but it is a acronym. Recently advanced guidelines are immediate after injury, you follow the peace protocol. The peace means protection of your activities, and elevation is elevate your injured part more than your heart level. It should be always elevate your injured part more than your heart level to drain the edema and fluid collection. And third one is avoid anti-inflammatory and avoid icing, because these anti-inflammatory drugs and icing delay your natural response. The same way, compression to cover with any elastic compression stockings or any crab bandages, those kind of things, you will compress and decrease your swelling over the joints. And also education is more important to educate the patient how to prevent your injuries, how to follow the guidelines of the physiotherapist. This is the after immediate injury response to guide this treatment. And second one is after few days or immediate of next day, you should follow the love protocol. Love means load, optimal load. As I said earlier, increase your load, increase your training rate on the basis of the 10% growth. The same thing, optimize. It should be optimized and recovery being the confident. And fourth one is V. V is the vascularization. Low impact of cardiovascular exercises will improve your activities in your regular activities. And the fifth one is exercise. Exercise is the mobility strengthening exercise. You should start easily. So recently we celebrated Valentine's Day, but as a physiotherapist, for us every day is Valentine's Day. So because we are following this peace and love for every patient, so we should compromise. It's like kind of you love me, I love you, you must love. This kind of argument we are following. And the thing is, next is we go by sequential wise from neck to toe. The first, the most common sports to get neck injuries are, can I ask, who is football player here? Football player? It's okay. So the most sport, every sports have high potential to get injuries in every sports, but some do carry more higher than the normal sports. So example in the football, having high potential injuries get in the neck. Example, cervical spondylitis, strains, sprains, and cervical fracture, and also the kind of sternocleidomastoid, mastoid strains, upper trapeze. To prevent these neck injuries, our Dr. Chandrahas will demonstrate the preventive strategies and how to protect your neck through the advanced physiotherapy guidelines.
Hello everyone, good morning. Myself Chandrahas. I am here with Venkatesh here. He will demonstrate he will show you how to do neck exercises. So could you please sit right forward please, and I want you to participate each and everyone. So this is for your guidelines. If you have neck pain also, it will work out for you. Please, okay. Venkatesh, do side bends. This is the McKenzie exercise. It will help you a lot with maintain your posture and treat your neck. Now forward bends, ups and downs. Sit erect. Don't sit lean. Sit erect. Good. Next, side rotations. Please follow him. This is your range of motion exercises to maintain your joint mobility. Then we'll slide to stretches. Upper trapezius stretch. So make a hand in below your thigh, one hand on the opposite neck, stretch it. You will feel stretch in the upper trapezius over here. Keep your one hand on the thigh. So you can feel the stretch over here. Nice stretch. Everyone, change your side to opposite. So this way of maintaining your neck in flexibility, so it will increase your flexibility and joint range of motion. This is the 4 exercises. You can do it regularly before going to sport. That means in the warm up. Next we will move to shoulder. Sir will continue.
Next is the shoulder. The shoulder injuries are common in the shoulder is acromioclavicular joint injuries and bursitis and impingement syndrome, shoulder arthritis, shoulder dislocation, separation and tears of the labrum, rotator cuff and tendons. The most important sport injuries are the pitcher syndrome. Pitcher syndrome is called by the rotator cuff tendinitis. Also it's called as a swimmer's syndrome. Due to these overhead movements in the high movements, especially overhead and high repetition at extreme positions. When the player will do overhead movements in higher repetitions at extreme position, they may get chances of these shoulder problems. Once these problems when comes, a player cannot move his shoulders internally, externally. To protect this overhead movements and to protect this tendinitis, you need to follow some physiotherapy guidelines. So we often known as this overhead athlete, we often known as over the playing the using more overhead activities like swimmers, volleyball players, baseball players. They have named as the overhead athletes. Okay, Dr. Chandrahas will demonstrate about how to protect your shoulders through the physiotherapy exercises.
So we'll start with the stretching of the deltoid, posterior deltoid, which is most important muscle. That's a cross arm stretch. You will cross your arm to the left side and stretch it towards it. Keep your hands straight, Step by step, go on step by step. See Venkatesh, how he's doing? Stretch it to the opposite side. You will feel stretch in the posterior part of your shoulder. So shoulder joint is in and around like full of muscles and the ligaments. It's a more important joint for overhead athletes. Good. And next the tricep stretch. See, for step by step. Hand elevated and take your back. Good. Then move to the next side. So these two and one more is important by scapula's mobilization. Stand. So what it is, you can do it in the sitting, but I want to show you how to do it. First is W stretch. Make a W and keep your scapula blades closer together. Fine? I don't know, there is not a. So you'll feel the stretch in the scapula. Fine? Relax. Now one more stretch is for your posture. You can do it in the sitting. So just do your shoulder shrugs, elevate your shoulder and then move your scapula blades closer together. That's maintain your thoracic posture and the shoulders. Everyone understand? Elbow region.
So before we are going to the elbow region, I need to explain this 4 type of manipulation techniques are there. The Mulligan manipulation technique, it will reduce your pain and it will improve your gliding of the shoulder. The same way, trigger point release. Trigger point release is a new technique in physiotherapy advanced guidelines. So it will give you a relaxation over the deltoid muscle as well triceps muscle. The pendulum exercises and wall climbing exercises are there, which is going to improve your shoulder range of motion. And next is what is the most common elbow injuries? There are 4 common elbow injuries are there, which is like tennis elbow, golfer's elbow, as well ulnar process, ulnar collateral ligament, as well rotator process stress fractures. So there is a contrary to popular belief is tennis elbow does exclusive players. So it is not true. Tennis elbow does not exclusive for the tennis players. It for everyone who can affect using their elbow, overusing their elbow joints, like pop, and overusing of the supination, pronation radialis muscle, as well external carpet radialis brevis. Whoever using these muscles overuse, they may get chances to tennis elbow. Contrary to the popular belief is, Sachin Tendulkar injured tennis elbow in 2004 and 2006. He underwent very good rehabilitation program. He got recovered and he played successful cricket matches for India. And he himself said he couldn't even hold the bat when he was suffering with the tennis elbow. So you can imagine how bad it is. So you just follow this preventive mechanism in the tennis elbow, like protective braces and eccentric strengthening exercises in the wrist. This will help for your preventive of the tennis elbow pain. So these remaining exercises, Dr. Chandrahas will demonstrate right away.
So for the wrist, we'll go to the wrist flexor stretch. Keep your hands straight. Keep your hands straight. Don't bend your elbow. Keep your hands straight. So stretch your wrist to the backwards. You will feel nice stretch in here. So those who are like, then again, now keep your wrist downwards and use of the opposite hand, stretch it towards you. Now you can feel the nice stretch on the upper region of your forearm. That's flexor and extensor component stretch. And then we'll move to eccentric flexor training, the strength part. So keep your hands straight, don't bend your elbow, move your wrist towards you and downwards, only wrist, don't bend your elbow, contract, that's eccentric contraction, so don't do the rotations, take it towards you and hold it. So you can see the picture over there. And next we'll move on to supination pronation. Just bend your elbow. Stand. He should demonstrate you how to supine pronate your forearm.
Like this last exercise in this picture. Like this.
In the picture it shows that someone is handling the hammer, but we are demonstrating lively. Sir, elbow bend your elbow, then rotate your forearm. Bend your elbow towards you, then rotate your forearm. Fine? These are the preventive measures for your golfer's elbow, tennis elbow.
So we are covered upper limb, all injuries of the upper limb, and next we are going to the lower limb, common injuries in the lower limb. The main factors are in the lower limb compared to the upper limb. There are 63% of the biomechanical force act on your lower limb muscles. You can see here that from trunk to ankle, from 9% in the trunk, thighs 12%, total 63% of the biomechanical forces acts in the lower limb. That's why people who are in the athletes and sports, they are putting more injuries in the lower limb compared to the upper limb. So what is the mechanism, what is the biomechanical changes are happening in the lower limb while you are playing in sports? I would like to speak on this topic step by step very briefly. The main common injuries in the sports are ACL, anterior cruciate ligament, PCL, posterior cruciate ligament, MCL, and meniscal injuries, and patellofemoral pain syndrome. So many sport injuries are there. So what are the causes of these lower limb injuries? The main cause is the importance of the Q angle. What is Q angle? The women's having Q angle 18 degrees and compared with the men's Q angle is 13 degrees. So because of the wider pelvis, women's having the more Q angle compared to the men's. For understand easily, I'll make a simple example. I'll give you a simple example. We are normal persons. So we have a normal Q angle. When the sports person, like they are normal subjects, they do hypermobility on the tibia. Hypermobility means it's like kind of country cross country cross runners. Those kind of activities, hypermobilities, it give more stress on your tibia and femur. It will damage your meniscus and it gives pain in the patellofemoral plane and also tibiofemoral forces also. It will create a inflammation in the knee joint. So to prevent this Q angle and strengthening your the quadriceps, the Q angle is nothing but it's a quadriceps angle. If you focus on the strengthening of the quadriceps muscle, you can protect knee arthritis and patellofemoral pain syndrome, ACL, PCL, those kind of problems. So we focus on this vastus medialis, the major muscle to protect your knee injuries. So we are focusing to learn these exercises by demonstrated by Dr. Chandrahas.
First, we'll move on to quadriceps stretch. So, subject is standing. Flex your knee and stretch it to backward. Maintain your posture straight, erect. So you can feel the nice stretch in the quadriceps. So anyone, there is a participant like I want a volunteer. So you can feel it. Better one male and one female.
Students MPD.
Yeah, there is an engine. Should I show? Demonstrate them. So better take it backward. So the way of stretching is more important. Why? Because I am telling you, your posture has to be in correct position. Help you out in knee mobility. Okay, relax. So next we move to the hamstring. You do it. Here, sorry. Stand erect, erect, erect. Then only you will feel the exact stretch of your quadriceps. Hold your thigh. Hold your thigh. Bend it. Hold your thigh with your hand. Then stretch your leg. So I can hear that your name. Keep your opposite leg to downwards.